Chapter 7: Reporting and Documenting Client Data. As a nursing assistant, one of your most important responsibilities is accurately reporting and documenting client information. This ensures that every member of the healthcare team has the information they need to provide the best possible care. Whether it's recording vital signs, tracking intake and output, or noticing changes in a client's condition, your observations are critical to their well-being. Vital signs give a snapshot of a client's overall health. Measuring temperature, pulse, respirations, and blood pressure helps detect changes that could indicate illness or distress. A sudden fever, an irregular pulse, or difficulty breathing can be early warning signs of a serious problem. If a client's vital signs fall outside the normal range, it's important to report it to a nurse immediately. Even small changes can provide crucial clues about their health. Beyond vital signs, paying attention to a client's comfort and behavior is just as important. Some clients may not be able to clearly express pain or discomfort, so look for signs like restlessness, facial expressions, or changes in appetite. If a client suddenly seems more confused, withdrawn, or agitated, it could indicate an underlying issue such as infection or medication side effects. Always trust your instincts. If something seems off, report it. Proper documentation is essential in healthcare. Everything you observe and do should be recorded accurately in a client's chart. This creates a legal record of care and helps ensure continuity between shifts. If something isn't documented, it's as if it never happened. When charting, be specific and objective. Instead of writing "client ate well," note how much they consumed. Instead of saying "client seemed uncomfortable," describe their exact behavior, such as grimacing or holding their side. Measuring and recording intake and output is another key part of documentation. Clients who are on fluid restrictions or at risk for dehydration need careful monitoring. Keep track of everything they drink, as well as food with high water content like soup or fruit. Output, including urine, stool, and vomit, should also be recorded, especially if a client has diarrhea or is retaining fluids. These details help the healthcare team assess kidney function, hydration levels, and overall health. Good communication is just as important as documentation. When reporting concerns to a nurse, be clear and concise. State what you observed, when it happened, and any changes from the client's normal behavior. If a client is in immediate distress, don't wait to document, get help right away. By being observant, thorough, and accurate in your records, you help ensure that every client receives the attention and treatment they need. Read the full chapter to get a fuller understanding of this subject in preparation for the quiz.